So my name's Lauren. Good morning, everyone. Welcome to our virtual Walk with the Future Doc. I'm a third-year medical student at WVU. Just wanted to introduce myself and give everyone a quick overview of what to expect over the next hour. So first, we're going to hear from Dr. Sam Zizzi about the topic of movement for mental health. And then as we walk together virtually, he'll be able to answer questions about the topic. Our Facebook page is WVU Walk with the Future Doc, and this is the best place to look for any updated information about all of our future walks. And then we kind of already went over this a little bit, but the last update was that we're going to be recording the walk today. You should have gotten like a little pop-up notification just to say that you're okay with the walk being recorded. And it'll just be the audio portion of the walk that will be recorded, not the video. So thank you for joining us today. It's always nice to see everyone, even though it's virtual still. And now I'd like to introduce everyone to Dr. Sam Zizzi, who is the Associate Dean for Research in WVU's College of Physical Activity and Sports Sciences. We're really excited to have him join us today and speak about the topic of movement for mental health.
Yeah, welcome everybody. Thank you for the kind introduction, Laura, and for the invitation from your group. I'm excited to join you. I'm in my favorite walking place here in Morgantown, which is White Park, and it's just starting to look like fall, just a little bit. You might see that in my background. I'm going to talk for just a few minutes today about exercise and mental health. My background is I've been a faculty member at WVU for it's my 21st year. It is clearly the strangest year because of COVID, and so certainly I think all of us, the topic of mental health is very important, and so finding out the best ways to prevent our mental health from getting any worse or to treat any sort of mental health problems we have, I think it's a pretty timely topic, I think. I teach classes in the psychology of exercise and sports psychology, so I've been very familiar with the research in this area for probably 25 years now. And I'm just always a crazy physical activity person. I love to be outdoors. I have a family, 3 girls and a wife, and we're always trying to be walking in the neighborhood, go hiking West Virginia's state parks, state forests. It's just something we do. It's something that's in our nature, and so it's become even more important for us during this time. I'm going to talk just about 2 things, and then I'll take as many questions as we have time for. I'm going to first talk a little bit about what the research says about just being in nature and how that relates to your mental health, because it's a very relevant topic right now. And then I'm going to talk about exercise for the prevention of mental health issues. So that's more for everybody who doesn't currently have the diagnosis of, anxiety or depression. But I'll be happy to take questions during the second part about exercise as a treatment for anxiety and depression. I'm also fairly familiar with that as well. And so I know there's a lot of aspiring and current health professionals on the call. So I'd be happy to talk about dosing and what things are appropriate. So let me first start out with one of my favorite topics, which is forest bathing. It's a term you may have seen around. It's become common in the last few years. And it came out of a series of research projects in Japan where they wanted to use nature therapy to treat the stress of Japanese businessmen and women. They had one of the highest rates of suicide and stress, good morning, in urban centers in Japan. So they created these centers of forest medicine. Just take for a second that, those of you who are health professionals, just think that term for just 1 second. Forest medicine, okay? This is what they were called, the translation was. So the basic experiments were designed that they identified people who had high stress, like heart attack risk, suicide risk. They took them into these forest bathing centers, forest medicine centers, and they asked them to spend the day being present in those environments. Well, they would ask them to pay attention to the sounds of birds. They would ask them to smell the trees, the cedar trees, and they would sit. So this is really more about being present and enjoying that environment, of course, free of distractions. They didn't have their phones. They didn't have any sort of anything impeding their attention. And then they would bring them back to their urban environments, and they would see how long the effects lasted. So thinking from a dosing standpoint. And the thing I really liked about this research was that they studied their cardiovascular responses, not self-report instruments. They were studying how the responses of their heart rate, their blood pressure, other cardiovascular markers. And so to give a quick summary, they found that 1 day exposure in these forest and medicine centers would result in 7 days of improved stress responses. And if they had a full weekend, like 2 days, it would give a month. So if you're thinking of taking care of yourself and managing your stress, if you could get out 1 day a week and spend some time in nature, and this is not the physical activity part of things, and you really are doing that without a lot of distractions, then you might carry that with you for the entire week. In other words, that might recharge your batteries for the rest of the 7-day period of time. If you can devote a full weekend, which many of us, that could be difficult, but you might bring that for a full month. Okay. On the physical activity side of things, as you can imagine, this topic has been widely studied in the last, probably since the 1980s, the idea of movement for mental health. I'm going to point out just a couple of tips here and to let you know what sort of how much do you need and what kind of things do you have to do. The most commonly studied type of physical activity is exactly what we're doing right now, walking. And that walking is typically studied at brisk walking pace. So the way to think about this is about 3 miles per hour for most people. So that would be a 20-minute mile. So you're going to increase your heart rate a little bit, you increase your breathing rate, but you can definitely have a conversation. But it's probably not been studied or shown to be efficacious to do the dog walking rate, where you're maybe every 15 feet you're stopping so your dog can sniff. So it has to be a little bit of physical activity, but you'd be surprised how much evidence there is to support low to moderate intensity physical activity. There was a pioneering guy that wrote a book called Calm Energy. If you're super interested in this topic, his name is Robert Thayer, Thayer. This book came out, if my memory is correct, in the late 90s, and he studied the efficacy of 10-minute walks. And he was studying it sort of in the course of a work day for adults. What would happen if, at the afternoon break, for example, people just took a 10-minute brisk walk instead of getting a Snickers bar or a Mountain Dew or whatever their thing would be to change that. And then he looked at their mood responses over the course of the next 2 to 4 hours. So what he found was the 10-minute walk was superior in terms of increasing their energy level, and it also resulted in a reduction in their tension levels, their perceived tension levels. Thus the name of his book, Calm Energy. So as opposed to when people like got a soda or some sort of candy bar, they would have an instant increase in their energy, but they would also have a rise in the tension that would go along with that. So the combination of the calmness that resulted, and that calmness generally stayed for 2 to 4 hours. So if you just think about the payoff here, the literature generally shows some sort of walk or movement, 10 to 20 minutes, will last in a mood-related benefit for 2 to 4 hours, which is pretty amazing. So that would mean like in a work day, if we can manage to get one sort of movement in the morning and one at lunch or in the afternoon, that should sort of keep us maintaining sort of a positive mood state through that period of time. There's a couple other factors that you're going to want to think about if you were to prescribe physical activity for mental health, or if you will want to build your own, if you're out there thinking about what can I do. I'm just going to go through a couple of these things. One of them is the intensity. We already talked about that. So I would recommend light to moderate. Moderate being the brisk walking. So if someone does not have a lot of physical activity experience, maybe they're not that fit, you should have them starting with something like 5 minutes of walking per day, literally 5 minutes. Once they're totally successful on that, then I might move to 10 minutes every day and try to make it like a daily dose as if they were taking medicine. Every day, find the right time. The next thing you would ask them to do is identify their most favorite and safe place that they could go and the activity that they enjoy the most. So you want to focus on enjoyment and the environment. For some people, that's going to mean they're going to feel much more safe on a stationary bike or a treadmill because they're worried about injury. For other people, they're just going to have to be outdoors or they're not going to enjoy it. So there isn't really any evidence to suggest that one particular activity, rowing or riding a bike, a recumbent bike. I mean, there's no evidence to suggest that one's going to be better than the other. It really has to do with, if you want people to be consistent with their physical activity, they need to enjoy it. They obviously have to have access to it. So there's a bit of an access here and a quality sort of piece. So one of the first questions I ever ask people if I'm working with them to do like health behavior counseling is, do they have access? Can they walk outside their home? Because that's the number one place people are physically active. And there's sidewalks, and do they have any home exercise equipment? So those are very important little questions to ask those of you who might become MDs or RMDs. Very simple. And what kind of things do you enjoy the most? Okay, so the first two pieces are the intensity, which should be low to moderate, and you're going to get good mood benefits out of that. The reason is, if you do vigorous exercise, most people, except athletes, they hate that. And so therefore your mood is going to get worse, and it will be not pleasant, and you'll be fatigued. That's why people drop out after a very intense exercise. So it's actually only athletes really that embrace the insanity of high intensity interval training or something. Remember, today we're not talking about the physiological benefits. I'm not an exercise physiologist. There are clear health-related benefits to doing moderate to vigorous physical activity for your heart, for pretty much every body system. But today, we're focused on mental health. If you want people to maximize their mental health, it should be low to moderate. So you got an enjoyable activity. You've got a location that's preferred by the client. And then you have the last piece that I just got there. The best benefits for mental health is that activity should be rhythmic in nature. So, and it should be non-competitive. So in other words, if I were to say to somebody, like let's say their activity was pick up basketball, I was working with a college student or something. If you're trying to predict mood-related benefits, that's a very unpredictable environment. I'm going to go play at the student rec center. There's a bunch of people playing with me. And it's very stop and start. It's not rhythmical. I could get involved with somebody. It's a competition. Now I'm mad because I lost the game. So you're not able to control all the elements. So the most common rhythmic activities, of course, are walking, jogging, riding a bike, an elliptical, a rowing machine. There's lots of options for that. But the reason that it's associated with is it's sort of like the meditative approach to breathing. When you get into doing aerobic activity, it creates sort of a steady state of breathing, and that rhythmic can create a calming effect and a homeostatic reaction in the body. So the time period for this stuff is generally, in the evidence, 20 to 40 minutes. So you can get some mood-related benefits on the short term with 10 minutes of walking, like just get a nice boost to your mood and reduce your tension. In terms of the prescription, it would be 20 to 40 minutes. You're trying to get people into that range, okay, for mental health. We are not talking today about ACSM physical activity guidelines for Americans. That's 30 minutes times 5 days a week, 150 total minutes. That's the sort of the gold standard for your physical health. Today we're talking about mental health, so 20 to 40 minutes, activity the person enjoys in a location they prefer, and rhythmic and a non-competitive type of setting. Okay, so that's sort of your prescription for movement for your mental health. And I would generally encourage people to try to figure out, like, as an experiment, build out, try some different locations, try some different activities, and figure out what it's going to be. If I was working with a brand new client or patient, I would treat them like, okay, well, let's try that, and I'll get some feedback. How did that go? And okay, we didn't like that, and you could change that. And you're trying to get them to obviously a sustained plan so that they can maintain their mental health. Okay, so I'm going to stop now. I think I've got in there about 10 or 15 minutes. Covered a little bit about nature, exposure, nature therapy. Happy to talk more about that. And also talked about prevention. So we could also talk about treatment, but I'm happy to answer any questions that you guys have. Who's going to be first?
I'll go first. This is Mia. So when you talk about this exercise, going for a walk or something like that, is this something you're doing when we're talking about the definition of exercise, something you're doing outside of your daily activities, right? So you're going and going for a walk with the purpose of like clearing your mind and things like that. Is that correct?
That would be more of the nature therapy thing. Yes, I would say this is not something you want to be multitasking this walk. If you want to maximize your mental health, it's not going to be listen to this podcast while I go out. It's going to be, but in terms of what Thayer studied, I don't think he controlled that factor. Like he wasn't, that was 20 some years ago, so it wasn't the same as now. So I think if I had somebody who was working with me and they really had to listen to music, they really had to be some other distraction that was going to actually help their mental health because their job was just beating them up and they needed this to listen to an episode of Seinfeld or something while they walked, then I would probably say that's great because then they can have that would keep them doing that. So I don't think that the evidence, Mia, tells me that you have to be mindful during your exercise. No, I don't think that's necessarily the case. Is it likely to be more enjoyable, especially in a time of COVID when we're being sort of bombarded with information that's not particularly pleasant? For me, it definitely is. The reason that I'm in the woods and the reason I chose to walk here today is because, you know, it's very different than my home office or my work, and it creates a different feeling by being in the sort of the changing seasons of nature. So I'm not sure all clients or patients would feel that way, however. So sorry, long-winded answer on that one.
That was good. Thank you.
What else should we talk about?
Hey, Sam. This is Rachel.
Hey, Rachel.
Hey, I was just curious if you could talk a little bit more about the concept of forest bathing for your mental health. I know that we keep talking about like the wellness aspect of it as well, but just the few minutes that can be achieved in like a forest setting.
Yeah, and I think after I read this forest bathing research, I was like thinking about could we do this in West Virginia? You know, I've been in our Center for Active West Virginia, and you guys can check out some of the work we have going on at activewv.org. We're always thinking about what can we do in West Virginia that's going to make physical activity sort of the normal behavior. We want that to be the easiest choice. And one of the greatest assets we have in West Virginia are green spaces. We have many struggles in West Virginia, but we have great parks, we have great state forests. And if those were treated as part of healthcare, boy, that would be a different conversation, wouldn't it, in the state of West Virginia? So that's what they were doing in Japan. This idea of forest bathing was that being in nature is part of your health care. This is something we separated out because we're very pharmaceutically driven in the United States. And if we have pain or anxiety, there's plenty of medications to treat that and a commercial that will take me to that. But that's our culture. So I've had a lot of luxury to travel, and that's not normal. That's just what we are in the US. So this concept of forest bathing is just being present and tuning into what's happening in nature. So today, it's a cool fall day. It's a little humid. I can still hear crickets this morning. I still see a leaf falling down. You might have missed that. And I see some spider webs. It has sort of a dry smell that is from the last week or so. We haven't had a lot of rain. And so it's really just absorbing the changing of the moment so that then you can capture that change of season in yourself. That's sort of more of a Buddhist Zen approach, forest bathing, because obviously that's Eastern culture, we're in Western culture. And so in my experience in teaching students to meditate in my classes, to breathe mindfully, it's like the first drink of water they've had in a year when you teach students this, because they're incredibly distracted. They don't really know what it's like to spend 5 minutes sitting with their breath. And after they have that experience, it can be stunning for them sometimes. Sometimes very uncomfortable because they don't like to sit still. So that forest bathing part is simply, doesn't translate well, the Japanese word. I don't think they mean to literally bathe. You're not taking a bath in the forest, but you are trying to surround yourself with whatever is happening in that natural environment. And it doesn't have to be a forest. It could be a park. It could be in your neighborhood. You could do that a lot of different ways. But it basically being mindful while you're having that experience and paying attention to what's around you.
Hey, Sam, it's Kathy.
Yeah. Hey, Kathy.
What suggestions would you have for our upcoming winter months where people don't really like to be outside in the cold?
Well, most people aren't going to like my advice on this one. I sort of subscribe to more of the there is no bad weather, just bad clothing. This would be the way I. So
True.
I mean, I'm a crazy person. I have run in 0, 5 degrees. I have hiked in single digits. About the only weather I won't get outside in is sleety, rainy, 38. That's probably the only weather you can't get me out in. So I think the first suggestion I would have is just there's still something that's very almost like cold weather exercise better because it is like urgent. The cold hits you right when you get outside and it's 20, it's crisp. It sort of like immediately makes you catch your breath. And so I actually think it's easier to be mindful. Whereas these days we're sort of used to 60 and 70 and we walk outside, it's nice. It doesn't hit you in the face. So for me, actually the cold weather, it's easier for me to be mindful, though I get it. A lot of people don't like to be out in that weather. I just think if you got the right gear, a nice pair of gloves and a warm jacket, we're just talking about walking here. I think still people could do 10 minutes, 15, 20 minutes. And even more so this winter when we're going to be stuck inside and we got COVID coming back around. I mean, it just seems so important for people to be outside and doing their physical activity as opposed to like going into an indoor gym or that's just not something I could recommend right now. So
I think that's a really good point. And I was curious, are these walks planning on continuing in the winter?
Oh, you can certainly count on me. I'm happy to drop in every now and then. It's definitely not going to stop me. I love cold weather hiking. Number one, there's nobody on the trail, so it gets even more like peaceful. Over the years, I've collected a few warm pieces of clothing, and I just wear those every time I have to go out, right? So
I think it's a really great thing for us to role model going out in the winter because I hear that so often from my patients is, well, I'll exercise when the weather is good. And I say the same thing every time. You live in West Virginia, right?
Right.
It's never going to be good. So you got to figure something else out.
Yeah, Laura, what happened to those ponchos, right?
Right, right.
Mia, do you want to take the question about whether these will continue in winter and a little bit about what we talked about?
Yes. So our plan is to continue them through the winter, still keep like every other week, 9 a.m. So we would love for you guys to keep joining us, asking questions. But our new thing is that we're trying to record these. So if people don't want to get out, or like if it's really rainy at 9 a.m. on a Saturday and it's just not their kind of weather to go out, they can listen to it later in the week. So we're going to try to publish these as a podcast. And so people can listen to them at their own convenience. So today's is being recorded, but just the audio.
Right. So basically we're going to ask people to layer up and buck up, go outside, which I think is great.
Well, and try it out, give it 10 or 15 minutes because it is harder. If it's super cold, an hour can be a long time if it's 15 or 20 degrees, but 10 or 15 minutes, I mean, especially if people have a dog, try to make it happen and then see I don't know. I think if people are still working from home this winter, which many people are going to be, it's even more, I feel like having talked to a lot of people, I mean, the trails are full here in Morgantown. People are at the parks. I mean, you can just feel the urge. People have to be outside right now. So it's a beautiful moment for us to promote being outside. And it's not going to change. It doesn't get that cold here, in West Virginia. So yes, it's a matter of attitude, and it's also a matter of clothing and gear. So many people can't afford that, but yeah, I think it's definitely still possible. Maybe in short bursts, you can get plenty of fitness in 3 10-minute walks. It's the exact equivalent, pretty much, of 30 minutes of sustained physical activity in terms of your physical health. So break it up, do shorter walks if you need to. I mean, kids, adults, we all need this dose right now being outside. If it weren't for walking and hiking during COVID, I'm sure I'd be in therapy.
Me too, definitely.
So this is my therapy right here. This is my. So I need it. It's not like I want to do it. I absolutely need it. I'm not going to be a good father. I'm not going to be able to function in my work. I'm not going to be a good husband in a positive mood unless I am able to get this dose. So this is important to me as any sort of daily medication that I could ever be asked to take.
Hey, Dr. Zizzi, the whole idea of forced bathing, have you seen data? Like, I have a lot of patients that, you know, they have the osteoarthritis, they're older, they're in the obesity medicine, medical weight management clinic, but their knees are really hurting. You know, they have that osteoarthritis of the knees, and walking outside is definitely hard. Is there any research out there showing that sitting in the outside forced bathing has benefit too? And I always wonder, if I just got the patients out and sitting, if they would try a 5-minute walk every so often, or if it changes anything about.
Most of the original forest bathing stuff I read, and I can dig it up if you remind me of via email, I'm happy to go look up some of those original studies. They were not having them do any sort of substantial physical activity. They mostly were. There was some sitting involved, and they would do some light walks in the morning in the woods, but it wasn't really about them being fit. So most of that work was sitting, being mindful, you know, literally like smelling the trees and like exposing themselves to the natural. So it was more like what you're talking about, is just be in nature, maybe get a little bit of movement, but the emphasis was not on, hey, let's walk for fitness, which would not be appropriate for those people anyway, right? Because it would be painful.
Hi, thank you for this talk. This is great so far. I have a question about people who already have mental health issues and are perhaps depressed and don't even want to go outside. And what would you do to get them over the hump of saying, you know what, 5 minutes is going to help you? Like might not want to get out of bed even. So.
Yeah, and I will say, for someone who's depressed, a 5-minute dose is not going to be enough. So the literature will generally suggest that you need more intense forms of physical activity to serve as a treatment. You can just think it in terms of dosage. If my depression is deep, which is a very lethargic condition, then the counter stimulus has to match that. So you eventually, for it to work, they would have to get up to do at least moderate physical activity. And it generally has to be 3 days a week for about 30 minutes. So you're aiming eventually to get that person to 3 times 30. So the way that, and this is for depression specifically, so let's talk about anxiety differently if anyone wants to ask about that, because they're a little bit different in the prescription. So for depression, the way it would work in treatment is typically alongside therapy. It would be a behavioral treatment where, okay, today your goal is, instead of sitting in bed all day or being sedentary, being stuck at home, your goal is to take a walk of X number of minutes. So depending on their fitness and what they can tolerate, they may have to start with 5 or 10, but they should not expect to see benefits until they got to maybe 30 minutes a day. So it would be, that's part of their treatment goals, is the way it would work. And they would log that, and then they would probably have some sort of journal that they would be seeing how it affected their mood, how it affected their day, their productivity, because depression can have a profound effect on relationships. It can have a profound effect on your work. So is this treatment working alongside therapy? I will say one thing for the MDs out there. The evidence generally shows that the physical activity is equivalent to most medications in terms of the outcomes you're going to get for the depression symptom reduction, but it doesn't amplify that symptom reduction. So because it works somewhat in the same way, it's going to change levels of epinephrine, norepinephrine, serotonin, all your monoamines is what generally the evidence suggests. So the ideal combination for the depressed patient would be some therapy, because they may need cognitive behavioral treatment of whatever is exposing them and causing them to be depressed, and the physical activity can serve as their medication alongside that. So that would be sort of best practice. Alternatively, if they don't want to be physically active, which is effective, they could take medication plus be in therapy, and that would also be a good treatment option for depression. Oh, last thing I will say about depression is modalities have been studied extensively, and really weight training or anaerobic stuff is equally equivalently effective to walking and other aerobic treatments. So for depression, they can do weightlifting, they could do CrossFit, they could do any sort of activity. It's just as equivalent. That's not true necessarily in anxiety. Thanks for that question.
Okay, so how would you approach anxiety?
Okay, so anxiety is a little different, right? Because if someone has clinical anxiety and you're treating that clinical anxiety, their baseline level, if you think about their stress response, is higher. And what has been found is for some people, anaerobic activity, such as weight training, can cause a reaction where it obviously leads to shortness of breath. Any of you who have ever done any weight training, it's sudden movements, they're higher intensity with rest. Then that those set of symptoms that you get from doing a bench press or a set of squats could actually induce anxiety in some patients, particularly those that have high anxiety or are prone to panic. So it's even more important that people with clinical anxiety do sort of low intensity, rhythmic activities that are more meditative in nature. So walking would be perfect. It's also important that it's in a predictable, comfortable environment, because again, you have an anxious patient. So you wouldn't want them, let's say they're socially anxious, maybe going onto the rail trail or out to a park is not the best idea. Maybe they might prefer and feel much more comfortable on a treadmill, on a recumbent mic, on a rowing machine, something of that nature. So you have to be a little more careful with the prescription, because the depressed patient, they're generally inside, they're generally lethargic. Your goal is to get them out. So outdoor physical activity or to another location, maybe walking with a friend because they don't have a lot of social contact. The anxious patient, there's definitely many forms of anxiety. But the stimulus needs to be sort of lower and calming in an effect. Also, like meditation is a good option if people don't want to be physically active. Mindfulness has been shown to be one of the strongest effects of mindfulness-based interventions is for the reduction of anxiety. So my guess is that low intensity rhythmic exercise is working the same way. It's just resulting in a very slow rhythmic pattern of breathing that increases the strength of the parasympathetic response in the body.
Great, thank you.
It's about as much brain power as I've ever been asked to come up with on a Saturday morning. So it's really interesting to try to like pull a few extra pieces out after a long week.
Well, we appreciate that.
It's fun. It's all good. And I get a nice walk in too. So.
Dr. Zizzi, this is Mia again. I was wondering if you could just talk a little bit about the concept of motivational interviewing.
Yeah, motivational interviewing. It's I've done a few workshops on these topics over the years in the med school, PT school, pharmacy school, and it's an interviewing technique. And there's an excellent book I would recommend to all health professionals that I use in my graduate classes called Motivational Interviewing in Healthcare. So if you all are interested in that book, I highly recommend it. It's written by the premier people in that area. So motivational interviewing in healthcare. So this technique is basically a set of questioning approaches that is non-directive and autonomy building. So it asks a lot of, it basically is about resolving ambivalence in a patient. So if we had this patient, for example, that is depressed and they want to feel better, but they're not really willing to take their medication. They want to feel better, but they don't really want to be physically active, even though they may identify those as possible effective treatments for that. So what the approach does in motivational interviewing is you simply sit with the patient and you do not try to resolve it. You don't make a plan, you don't take charge, you don't help them organize it. You simply let them sit with this ambivalence. And you use questions like, well, I mean, tell me a little bit about your motivation to feel better, and maybe use scale 1 to 9. They give a number on that. Why did you give it that number? Okay, if it was a 6, it was a 7. They're forced to do a lot of the work in a motivational interviewing session. And then when the counselor or the healthcare professional notices that there's competing motives, yes, I want to be physically active and feel better, but yes, I'm also very comfortable sitting at home and I don't have to do anything. It's also easy to do. You simply point that out to them, and then you say, hey, I've noticed these two things here, and what do you think about that? You just sort of throw it back to them. So you try to not be judging. You try to be open with them. And it's more of a problem solving type of situation where you're in the passenger seat of that consultation. The patient is in the driver's seat, and they decide where they're going, how fast they're going, where they're going first, every single step of it. Okay, so it would feel very challenging for some counselors or some doctors to take that this approach, but the idea behind it is that it would lead the client to take the first step forward. The way I typically teach this in my classes or my workshop is I bring a student up to the front of the class. We stand sort of next to each other, face to face, obviously pre-COVID. So and then I will show what happens if the counselor, if I was just playing a counselor, chases the client. So if I'm going after the client, I move toward the client will naturally step back. And now the motion is that the client goes back there to become defensive. If instead the counselor or the doctor moves back, gives the client space, invites them to step forward in whatever direction they want to go, that's the sort of the tone, the feel of motivational interviewing, is you're trying to get the client to take the first steps and then provide any sort of support that you could for that. And so that is supposed to help them build autonomy, help them build, it's based on the theory of self-determination. So there's three key pieces to that. First is this autonomy, which is based on their choice, they're being in control of their health. The second is relationships. So they will be more motivated if they can have relationships and have that social support element. And then their competence to do whatever that behavior is. So those are the three sort of pieces underlying helping people build their competence, helping people build their need for social relationships, and how could, for example, physical activity do that for them? And then also how could it support their autonomy, like choosing which activity, choosing when to go, choosing where to be physically active. Those are all pieces that are very important to me in my physical activity and sustain my motivation. So hopefully that's a short treatment on motivational interviewing, hopefully. Anybody else? Starting to see a few more people out here at White Park. Got some softball practice going on, a few other people walking around. It's kind of quiet. It's nice.
What is your take, Sam, with the COVID and exercise? Like, my family has maintained hiking, but of course we pass people, so I tend to wear a mask around my neck when we hike. But with everybody out and about, I can even go into really remote areas to hike, and I still pass people this year.
Yeah, it's true. It's like both good. Like, I'm so excited to see people out, right?
Yeah, I went up to Cooper's Rock last weekend, and I told my mom at the time that I was a little disheartened at how crowded it was, and also a little bit excited how crowded it was.
I feel the same way. Way. I mean, everything I've read about, sort of transmission is, of course, prioritizing indoor transmission. So I think, for the most part,
I've taken it.
Right, most part, I think you could feel good, but there's no reason that people, if they were at risk and they were going to maybe be on the rail trail in Morgantown, as an example, can get kind of crowded. You could certainly wear a mask walking, and that's really not that much of a problem. I've seen videos of people competing in like Olympic level 10,000 meters in a full asthma mask and like running sub 5-minute miles. So I think we could probably walk in a mask and be okay. So I think that's where we've gone with our family, is sort of walks out in the neighborhood. Once a week, we try to get out and do something together that's outside. That's where we feel comfortable. I agree. I usually have a mask in my pocket in case, we get into a situation that's a little uncomfortable. But for me right now, throughout the entire winter, my intention will be to be outside as much as possible. Yeah. Like actually, this 9 o'clock slot is my normal Saturday yoga class with my wife. Like one of our favorite traditions is Saturday morning yoga, and we have a great favorite instructor. And like, there's just no way we're going to feel good about going back to indoor yoga right now. So we've given that up instead for hiking and walking, and I will be continuing that until the very distant future, I imagine. So, yeah, so it's just my preference too. So for me, it fits well because of work being more indoors and more in my house because of COVID. I feel like my motivation and my urge to get out is the strongest it's probably ever been in my whole life. So I'm sure a lot of people feel that way. And I think if we can capitalize on this, maybe a lot of people start a new habit, and then they just, after 5, 6 months, a year, they're like, this is what they normally do. So I think it's a beautiful moment to promote it to people who aren't normally physically active. That's our focus in the center for Active West Virginia. Is we're not the XFIZ program. We're not focused on fitness, and we're focused on getting people moving, and maybe just a little bit more movement for those who are somewhat active. We really want to hit the grand majority of West Virginia citizens who aren't doing much, and make it easier. Maybe help them get rolling and help them get started. So I think outdoors is our best option in West Virginia. People love this, to be out. They love to look at the leaves. So this season, get out, check out your leaves at a park, get some time out of your house, get your children out. Kids are going crazy on their screens too, obviously, so we just kick our children out, like, go, get outside. So I think you're on the right path.
I've been talking with patients a little bit about the rail trail in Morgantown. If you go right downtown, it's kind of inhibitory on how many people are there. But if you get to the outskirts or just go the opposite direction,
oh yeah,
it's not nearly as bad in Morgantown. So you'll find me in wooded sections.
And I think that's a good point, is that because the rail trail is mostly destination, people drive there and then they walk. They just encourage them to choose a different starting point, and they shouldn't be a problem. In terms of Cooper's Rock, those of you who are Morgantown, all I can tell you is just go find a clay furnace. So that's the only tip I'm going to give you, because I don't want to give away my favorite routes in there. But just go find the clay furnace, and you will get away from people, no problem.
The Reedsville spot to start on the rail trail is really nice. I don't know if anyone's ever checked it out, but it's
really nice. Huge parking lot, and it feels very remote. And they just updated that connector there into Reedsville as well. That was a project that we were lucky to help fund through the center. There's a connector between the local park there in Reedsville and the rail trail. And it's only from Morgantown, it's about a 20-minute drive out there. And you can get into, it's probably quicker than Cooper's Rock actually to get out there. And you won't find hardly anyone out there.
Yeah, we jump on at Arthurdale or Reedsville.
Yeah.
There's 2 big parking lots out that way. And the one at Reedsville, I think, even has bathrooms.
Rachel, we were out there. There's one in the park, maybe.
Where I park there's one.
Yeah, there is one on the other side, Masontown, because they put in a new.
Maybe it's Masontown. Yeah.
Masontown at that church. I don't remember the name of that location, but they put some new facilities there on the way to Masontown. Honestly, I've found, because of being desperate to find these places, we've hiked in. I've been living in Morgantown for 23 years now, and I've found places and been places this summer during COVID that I never even knew existed, because we've just been getting tired of going to the same places, and then maybe it's crowded. So we've really explored, and there's more than I even knew, which is crazy. You just get into your normal habits of where you go. All those places are more crowded now. But there's so many other good spots within 15, 20, 30 minutes that are not as crowded. And so, yeah, we've just been, that's been fun, trying to find new places and exploring. And that's been helpful, because really, isn't it difficult right now to find any sort of new experience? It feels a little bit like Groundhog Day most days. So any new experience, I think, motivates the kids. They're excited about it, because it's just a lot of the same. And so trying to be safe while exploring, that's what we're going with.
All right, do we have any final questions for Dr. Zizzi today? If anybody would like to unmute themselves and ask. go ahead. All right, Dr. Zizzi, do you have any final words?
Nope. I'd say everyone stay healthy and stay safe. And I hope you can find a new space to be active. And I've enjoyed talking with everyone. It's been a blessing. And have a great weekend, everybody.
Yeah, thank you so much. Yeah, thank you for speaking today. If everybody wouldn't mind, before you log off, in the chat, if you could send the location or who you are and where you're walking today, that would be awesome. We're just trying to keep track of how far this program reaches. And as we mentioned a couple of times, this was recorded today, but just the audio, and we're going to post it somewhere. We aren't sure entirely where yet, but we want to reach more people and make this more accessible because the conversations have been really good and hopefully really informative for people. Our next walk is going to be in 2 weeks on a Saturday at 9 a.m. and the speaker will be Dr. Lisa Costello, and she is in pediatrics at WVU Medicine, and she is going to be talking a little bit about advocacy in medicine. So different topic, should be really interesting. So thanks so much everyone for walking with us today. Enjoy your weekend. I hope that you all stay well and stay healthy.
Bye-bye.